Honeywell alone is repurposing a factory that was destined for Mexico to produce another 120 million masks per year. 3M is increasing output to 420 million masks per year. We've put a priority at the President's direction on making sure those that are providing healthcare services to America have the protection to keep themselves and their families safe. And with the legislation last night, with the incredible response among these great private sector companies, and as we mentioned repeatedly, with construction companies around America heeding the President's call to donate their industrial masks to hospitals, it's happening all over America, we know we'll meet that need.
But when will those be ready? Isn't that
So
kind
how
of
many
sad? They have to
masks
use
are
a
being
big...
made, and when will they be ready, or at least we start getting them ready?
Well, as I mentioned, 3M is increasing their output to 420 million a year. At production in January, they make 35 million per month at that facility, and we're prioritizing the distribution of those. But the other thing, and we'll emphasize this with governors this afternoon, is we're working with governors to make sure that the healthcare providers, the hospitals, and the clinics in their state are placing orders now that this tremendous increase in supply, particularly with industrial masks, is now available. We're going to make sure they understand that the supply has greatly expanded thanks to a bipartisan legislation and the accomplishment of the President. And the response by these companies is making more masks available. And we're going to make sure healthcare providers are purchasing those. And the federal government will also make sure that our stockpile properly reflects those increases as well.
So, on the President's question, when will those masks be ready for, because they need them like today?
They're available now. The 3M facility that I was at told me that in January they went to full production on 35 million masks. The legislative change means that all 35 million of those that started to be produced at full capacity in January can now be sold to hospitals. That's the distinction here. It's a very important change, and it's part of the way the President has been engaging the private sector, pushing the kind of regulatory reform and the kind of liability reform that has greatly expanded the availability of masks. So they're in the market.